Number one difference between this case and other cases. Number one, what? Okay, 2 patients, but what about this patient? She's awake, okay? And then second, I don't know if they had it in the video. Patient's partner comes in. Okay? That's the only surgery where a non-surgical person is allowed in the OR.
They're bunnied up, they have their bunny suit, their PPE on, their mask, their whole...
So they are also awake. They can also hear everything, and sometimes they like to stand up and look, and they can see things as well, okay? So be very mindful what you say.
Since there's a lot of fluid, you make sure that you have eye protection on.
Always.
I get some eye protection.
You can get chlamydia in your eye. Can you guys get some goggles for my tech?
It wouldn't be the first time.
Excuse me.
All right, so first things first, what do we do?
Mark.
No, we don't.
Sorry.
All right, timeout. The tech says it. No, sorry.
Oh, timeout. We have Haley Gray. Date of birth is 03/03/1999. In for a cesarean section with Dr. Garza. Is allergic to nickel and avocado.
Okay, no nickel on the field. And it's a primary C-section. I want you guys to list if it's primary or secondary because it changes the case. It makes a big difference. Okay? And then on laps, can you just put 20? We're starting with 20, so just put 20. Too many numbers. Okay, Mom, I'm going to test. You should feel pressure but no pain. Do you feel that?
Number 62, test anesthetic.
You good? No pain, right? You're going to feel us touching you, but no pain. All right, we're good. Marking pen?
So why does it matter for primary versus secondary C-section? Why do we need to know? Scarring and bleeding. So anatomically structures on a primary C-section are all there.
blade?
On a secondary, it could be altered because of scar tissue.
Clean blade.
Don't keep your blade up on your Mayo, okay?
Okay.
Start.
Incision.
So your test out form literally tells you what to do. It might skip a couple steps, but overall.
Take Bovie. Nice back. I'm boving through sub-Q. Goulet. Mayo. Is your Bonnie? So this is fascia, technically. Thank
Fascia
you.
makes
Look at my good tech. I didn't even have to ask him.
for traumatic, so
What is it doing?
spines,
Holding the retractor.
Holding the retractor.
I can see.
curved mayos, that fascia's tough.
So when fascia's cut, it kind of goes up at an angle because we need small incision, but we need a lot of room inside, right? Is that fascia?
Yeah.
Those are white.
Wanna go?
What's this?
Wanna go deeper?
Put it upside down.
I think I did.
I don't know.
Some of you guys can stand behind Garza's back and see better.
We can't see
You
it.
wanna put the retractors a little bit deeper?
Yeah.
Welcome to the world of
Deeper
surgery.
retraction.
You can see everything.
From right there? Nah, I'm good.
Smart. Like I can share with you. No. If you stand up, you can see it.
Yeah, no, the theater room.
Right? Perfect view, right?
Okay, so between the fascia and the muscle, what is this midline muscle that attaches? Linea alba, okay? So I'm coming in, I'm making room. This linea alba is here. So I'm gonna come in, some retraction here. I'm cutting the linea alba, okay?
Want some pokers?
Not yet. And then now I'm poking through the muscle and peritoneum, Got fascia over there. Out. And you're gonna pull with me. Pull out.
Mama, don't go.
Bladder blade.
What's the bladder blade do?
Hold the bladder.
Up.
You want a
Okay.
bladder flap?
It retracts
Yeah.
and it protects the bladder.
I'm gonna do a bladder flap. He asked if I'm gonna do a bladder flap, so I want. Let me get a Russian.
Russian?
Yeah, Russian. Russian. Yeah.
What's the
Right-handed.
bladder flap? Bladder flap.
Isn't it too
What
manipulative?
anatomy is here?
What are you cutting now?
Bladder flap.
Bladder flap. What's that mean?
So then this bladder blade will go there. And
It's
we'll
to
just push
help
this up.
making sure that the bladder and the uterus are not, you know, connected, and it's
All right.
gonna protect the bladder.
You ready?
Yep.
Baby's a little transverse.
Transverse?
Yeah.
Did you do uterine incision to miss it?
No,
Not
not,
yet.
yet.
Okay.
She's
Normally baby move baby from here,
You
but
can feel the, you know, the baby from the outside of the uterus and kind of feel what position they are in. So there's a lot of manipulating of the uterus.
yeah.
Getting excited?
Right now I am checking to make sure where baby is, the anatomy, so that I know where to make my uterine incision, so I don't harm baby, and also want to look out for large blood vessels also. Okay.
a lot of times with these cases, the baby usually has head down because they're trying to come out, but sometimes that's not the deal. So right now in this instance, the baby's transverse. So the doctor had to manipulate
Transverse,
it.
it's this way. Okay. So I'll take a knife.
Nice. Clean blade.
Okay. Hold this down.
Was it the peritoneum open with the muscle in the finger?
I'll take
Uterine?
section.
Peritoneum is open on like 70, pass meds and bombs and appropriate.
It was a uterine.
Uterine incision. So write down uterine incision. Okay.
So you see how you announce uterine incision?
And then
So
when you're
every time I cut, because we don't want to put a lot of pressure on the blade, and uteruses are thick. Okay, I'm through. I'll take bandage scissors. If we have to extend the incision, we'll take bandage scissors.
So bandage scissors will be able to protect the baby and extend the
Middle out.
incision. So you hear what he said, middle out?
Okay. Pop bag.
That's for 3 points.
you want Alice?
Yeah, Alice is fine. Alice, to pop the bag. Before we pop bag, we're doing this. Why do you think we're doing this?
Get ready for the fluid.
To save your socks.
Yeah, save your socks.
Clear fluid.
Clear fluid.
Why are they saying clear fluid? What can happen?
Blood.
You need a stool?
Yeah, can I get a stool?
Meconium. Okay, the baby poops.
Can I get some
First
fundal
ones are called
pressure?
Meconium, and
I get a
if it's
stool?
dark fluid, what do
He
you
needs
need?
a stool. Alright.
Yeah, already did.
Everybody says clear fluid. It's not anybody's specific task. We just-
That's just what we do here. Fundal pressure? Smart.
I think you got it.
So again, fundal pressure.
You're gonna feel some pressure, Mama.
You want a vacuum?
No, no, I got it.
Head out.
Workout.
Head up. Did you hear he said, do you want a vacuum?
Shoulders out.
Shoulders
Baby out.
Baby's out. Go ahead, section.
Okay.
Next to the baby's head. Okay, next, so bandage scissors, clamps. Your 2
30
clamps.
second delay. Watch the baby's head.
Can I get the kick bucket a little bit more exposed?
Clamp.
Kick it, twist it.
Been 30 seconds. Yes, it has.
Yeah, you have to watch the baby's head. Good.
Just a little bit more out.
Oh, more out.
Cut. My baby nurse is ready.
Can you see it here?
So the baby nurse is ready. She's sterile. Okay, she's got the sterile blanket.
Voila.
She's sterile. Baby
Let me
goes
get,
off.
We have the baby.
Yeah.
It depends. Certain ORs don't let babies pass. Miss Kendria did. She was high risk.
We're getting cord blood, collecting cord blood. That's good.
Specimen cup ready, so again, baby's off.
And
There's no
then,
points
and
for
then
that.
hand me this.
Baby off, okay? Then
Mhm.
specimen cup ready, cord blood.
For blood.
What's the
You want a
Ask
ring?
all the questions.
Yeah.
Have container ready for placenta.
Placenta's out. This is wet on top.
Thanks, yeah. Any leftover, I'm checking the uterus here.
Did you want to pass out
Alright.
the placenta?
Yeah.
Yeah.
Go ahead and send that.
I have a placenta passing on.
Okay.
Yeah.
And he already gave me my wet lap. Let's take another wet lap.
So number 83 says pass 2 dry laps
Alright.
and 1 wet one.
You want bladder blade?
Okay, the wet
Please.
one goes around the uterus to keep it moist. The dry one
You want it
goes in
Pennington's?
between out.
Yes.
I have Foresters. Is that okay?
Forrester's fine.
Yeah, and then it says Pennington here, but we don't have any, so it also says ring forceps. So,
Did you want 3 or 2?
Two's fine.
2 fine.
She's not
Usually I'll
paying that
pass
much.
off this as well for the dad to cut.
the dad can cut the umbilical cord when the baby's over there.
So we have instruments on and off the field, right? Did you send placenta off?
Yeah, I did. Oh, this is part of it?
I have no laps. Thank you.
That's procedure.
Oh, I did, I forgot Coker's times 2 for the,
Yeah.
no, okay.
Alright, Ovicro.
Okay.
So
And
now
I'll
we're
take the
going.
Russian.
Russians.
That's a big
Uteruses are like this thick.
Yeah.
Yeah.
Uteruses are big.
So we want a big needle so we can get through,
You saw
one
that in the video,
bite.
that was a big needle.
and then the second bite.
They usually do with Russian.
It was O?
Yeah, I like a certain preference.
Is Vicro usually?
Ovicro.
What in the world is this? It's the,
Oh, Vicro, because the
This is Stratasix.
uterus needs to be able to heal,
Why is that one?
absorb, because when we have more
It's,
babies, we don't need the
serrated.
suture
It's
to
that
kinda
barbed
constrict.
strap, whatever. Go ahead and cut.
Cut.
Okay. Notice how he's not starting his count yet?
Alright.
You knew I needed to cut.
Ready
One
for
more
a
lap on
count?
the field. Thank you. One part I forgot was when we are, after
Yeah, okay.
Just bring them over here.
our, layers were a little off, so it threw me off. But after we do our, fascia opening, we do 2 cokers on top. And then that's when we do the linea alba, and then 2 on the bottom, and we just make room, okay? Go for it.
What do you use? Oh. Let me know when you're ready.
Are you okay with the instruments in here as well?
Can you see
Yeah, that's
this?
fine. You can hang them on top.
No, hang them please so
Hang
we
'em
can
on
see them.
the-
What do you mean?
Right there, you see how they're. You can hang them.
Hang them. Mm-hmm.
Yes, that would have been smarter. Can you see the lips?
He's gonna grab them. So we're gonna utilize this as well.
We want you guys to start doing.
You guys are always supposed to use that. The second laps come off the field, the circulator needs to pick them up and put them in that counter. You get section? Inside.
Where's the hell's that one?
You'll probably go through 20 laps, just in the real world. Lot of blood, lot of fluid. Okay, I'm ready for count.
Alright.
Your teacher just likes to throw
Alright,
in.
laps. I have 1, 2, 3 on the field. 4, 5. 1, 2, 3, 4, 5. For 10. 1, 2, 3, 4, 5. For 15. 1,
2, 3, 4, 5.
20. Perfect. Alright, blades I have 1, 2. What else next?
Is it a soft count or a full count?
Full count.
That's right.
Sutures. I have 1 working. 2, 3, 4. Bovie, I have 1 on the field. And then, ready for instruments? Alright, penetrating towel clamps, I have 1, 2. Non-penetrating, I have 1, 2. Kellys, I have 1, 2, 3, 4. Straight Kellys, I have 1, 2. Cokers, I have 1, 2, 3, 4. Alice, I have 1, 2, 3, 4. Babcocks, 1, 2. Forsters, I have on the field none. 1, 2, 3. 1, 2, 3, and 4. Hades, I have off the field, 1, 2. Needle drivers, I have 1 working, 2. And then scissors, I have straight suture scissors, 1. Pair of mats, 1. If that's off the listers.
Yes.
Yeah.
Bandage scissors were to dad.
Yeah, listers off the field, 1. Pickups, I have Russians on the field.
This stuff's
I have two Dutchess, 1, 2. I have red tooth 1, and then I messed that up. Let me do that again.
Okay.
I have a Russian on the field. The Makeys, Bonnie's. I just said a tooth accent 1, 2. Rat tooth 1. The retractors, I have bladder
Okay.
blade on the field, and
Protectors.
I have Goulet's 1, 2. Richardson 1, 2. Hubert 1.
Correct.
You want to put back the
Where's the?
uterus?
That's why I said the pick bucket's right here. Let me check the gutters.
And count is complete.
Yes.
Right. First count is correct and complete.
You guys don't have full
Pick up.
sections on this?
Yeah, we didn't put it though.
Okay.
All right, so sometimes I'll get a little bit of irrigation.
And then we would switch off. Or you want to do a wash off after, right? too?
After when I get it back in, just to get this back in. Up. Let's get up. Is that it? All right, and this is when mom feels really nauseous. And then we put her to sleep. Do a washout right now. Take irrigation.
All right. And usually right here I would get warm saline. Warm saline. I would switch off my suction with my yank over with the pool. Warm saline. Irrigation. And then I'll have my pool suction.
Isn't that good? Bogey a little. Okay.
Ready for next stitch?
Yeah.
Alright.
I want you to reaffirm me.
Yeah, everything looks good.
It looks beautiful, huh?
No bleeders.
Thank you.
Want to take these out? Too late.
And then we'll just, where the hell's my phone? So this is doctor preference. They will do peritoneum or go straight to fascia or muscle or whatever. I just did uterus. I'm going to fascia, and then I'll do, what do we do? Sub-Q and then skin.
Sub-Q, yeah.
So I'm at fascia. I'll take Coker.
Okay. One second.
They use this as a tag. Remember when I cut fascia, I cut it up under the skin and at an angle. They want to know where their fascia is ending, so they'll go and look. They'll clamp it, and that's where their end is. And they don't lose it.
Oh, Vicro?
Bonnie or... Thank you.
Uh-huh.
Can you hold it on this side?
Yeah.
I don't need that side, just this side right now. Nope, we didn't close it, or the muscle.
So this is where the second count will start?
Yep.
A full count? No.
Nope,
clearance?
it'll be full.
It's still full.
If she chooses not to close the peritoneum, you still need a full count. Does that make sense? If the peritoneum is not closed individually, there's still an open cavity. Oh, yeah, absolutely.
Get 2 laps up. real quick.
Thank you.
Alright, ready for my cap. Alright, laps. I have 1, 2 on the field. 3, 4, 5. 1, 2, 3, 4, 5 for 10. 1, 2,
3, 4, 5.
13.
1, 2, 3, 4, 5,
1 second. Alright. Blades, I have 1, 2. Sutures, I have 1 working. 2, 3, 4. Bovie, I have 1. And then, right instruments. Alright, non-penetrating top counts, I have 1, 2. Penetrating top counts, I have 1, 2. Non-penetrating 1, 2. The Kellys, I have 1, 2, 3, 4. Straight Kellys, 1, 2. Cokers, I have 4. Over here, 1, 2, 3, 4. Oh, 3, 4 right here. Alice, I have 1, 2, 3, 4. Babcocks, 1, 2. Forcers, I have 1, 2, 3 on the field, on the male, 4. Needle drivers, I have 1 working, and 2.
Peonies, 1, 2 off the needle.
Yeah, peonies, alright. On my male, I have suture scissors, 1. And then I have pair of males, 1. Mets, 1.
Bandage scissors, 1 off the field.
Perfect. Rat tooth, I have, well actually, Bonnie's 1 working. I have Russians on male, 1. Bakey's on male, 1. Rat tooth, 1. Athens, tooth Athens, 1, 2. I have Goulet's 1, 2 on the field. 1 second. Goulet's 1, 2. Bladder Blade 1. Rich, I have 1, 2. Fever, I have 1.
Okay, count correct.
Second count's correct.
See how he's following me with the goulet, moving it as I go? Okay.
Make sure that you notice on this test out form
Oh, we
that
cut.
after
Alright.
every count, you have to let the doctor know that the count was correct. Okay? If you do not, that you're missing 3 points.
Okay, you can let go of that one, follow me.
Circulators,
just leave it
in the
there.
beginning, you can remember the clamps off the field, but during a test out,
I feel like the
you
bottom one
cannot say,
is less.
don't forget your
related.
Oh,
clamps.
okay.
It is your job as the tech to make sure that you know that you have instruments off the fields, okay? If you do not count it correctly, I'm not giving you points because you missed your count,
This is called following.
okay?
I asked Mr. Valencia or my tech to follow me once he's done with this count. Sometimes they won't wait till you're done.
It's during your count you gotta follow, so we'll test you on that later.
Over here. I'm not gonna walk it. This way.
I can follow with one hand and still count. Because you can feel, you have to pay attention to the feel. When they pull that stitch, that means let go, and then
That's
they
fine.
slap it back in your
Take it
hand,
off.
and then you grab
You
it.
want it off?
I'm gonna take this one
You
off.
let go,
Okay,
and
no.
grab.
Just out the way.
And then after that, everything else you guys should know already. You guys already know how to do your counts. You already know how to ask
Beautiful.
anesthesia to break sterility, roll down the drapes, put in the biohazard. Okay, so there's, towards the end, there's not much new.
I got it.
Okay?
And then we are gonna go sub 2. What do you have for me?
Of,
2-0?
Yeah, I could do a 2-0. I'm gonna reuse this one.
Good cut. Above my knot. Thank you. Needle back protected.
Alright, let's do this one again.
So we're at sub Q.
You want two that in, or do you want? what do you
I
want?
like the Russian.
Russian?
Yeah. OBs love their Russians.
Yes, GYNs, Russians are like their
Cool.
best friends. Russians and curved Camaros and relays. Those are their top 3 instruments.
Ooh,
Alright.
it's different texture.
Feels
I had a
weird,
set
right?
where I didn't have relays, my surgeon worked out.
Oh yeah, they love buoys. Love that. It's a short one. It's a shorty.
It's a bait.
So it came all the way through. So let your doctor know if it's a remnant or if it's a shorty, because they know by feel how long their suture is usually. They're different lengths.
They're all different lengths.
Or if you have a remnant, be like, is this enough? Go ahead and cut.
They can be 36 inches, 18
Alright.
inches, 24 inches.
Ready for a count?
So,
Laps, I have 1, 2 on the field. 3, 4, 5. 1, 2, 3, 4, 5 for 10. 1 and 2.
3, 4, 5, 15, 1, 2, 3, 4, 5, 20.
Alright, and I have blades, I have 1, 2. Sutures, I have 1 working. 2 and 3, 4. And then Bowie, I have 1. Count is correct.
Thank you. Oh, Vicro Professional.
sometimes for the, like sub-Q, they use a straight needle, it's called a Keith needle, and they literally just push it through with their fingers. It's weird.
I'm using a Keith on the skin. I didn't.
Doctor's preference.
Doctor's preference. You can use a chromic tool or a
It's gonna be absorbable.
plain.
Plain.
It's a
chromic,
2030.
Micro.
Because peritoneum is what? What kind of tissue is peritoneum? Very. Here, in the back. That's it. All right, cool.
You read your surgeon's record. And then again, the surgeon has every right to change their mind during the case. They'll be like, oh, no, I don't want to, this patient has maybe diabetes. I don't want to use that stitch that's on my card. I want something different. So you just
Oh, wow.
I thought it was on there.
You just ask for something different.
You want it on the needle?
Just ask for something different.
Or you want me to get it curved?
It's fine, Juan.
Alright.
I have delicate fingers. Did you cut the other end off?
Yeah, I did.
Skin,
Alright.
C-section, like.
So my tech gives me the closed skin.
Typically-
So you want to be here for 10 hours.
Alright. Ready for a self count? Yep. Alright, laps. I have 1, 2, 3, 4, 5. I have 1, 2, 3, 4, 5, 10. 1, 2.
3, 4, 5, 15, 1, 2, 3, 4, 5, 20.
Perfect. Blades, I have 1, 2. Sutures, I have 1 working. 2, 3, 4. Bowie, I have 1. That's correct. I have a lap on the floor.
This is final.
Yeah.
All right. I'm gonna need a pressure dressing.
Pressure dressing. You want it with foam tape? We're gonna use that other
Foam
one.
tape and a Mepilex for her, please.
Can I get Metflex as well? And can I get my pen? Oh, no.
How's baby doing?
Concussion.
Ah,
Baby's unconscious.
hit the mail. Baby had to go to NICU? What were APGARs?
7, 9.
Oh. Okay, Mama. Did Mama say goodbye?
No. No, she out.
She's out. Okay. Dad went with Mom? With baby? Dad?
I ain't got no more kids. I
Daddy usually goes with baby.
Dad usually goes with baby.
I need a DNA test.
That's your baby?
I need to get DNA test for the ASAP.
The baby little light. Little light skin.
You didn't use the Alexa?
I use Alexis. I use my toaster. It's okay. We'll throw it at him.
No stay strips? We can pull this up.
Yeah.
What is the healthy baby weight?
Healthy baby weight? Anything under 5 pounds, they have to go to NICU. Right? 5 pounds? So, anything over 5 is good. 12 is not healthy.
Is it 12?
12. 12 is not healthy.
2 pounds, 14 and a half pounds.
You were? You were a 2-pound baby?
No, my daughter was 2 pounds.
Aw.
14 and a half pounds. My son was 8, almost 9.
I was almost 10. Miss Kelly beats us all.
I was 10.4.
Whoa!
How much
I was 10 pounds 4 ounces.
You go back.
3 weeks late, because back in my day, they didn't really induce, they just let you go.
You're so man. 3
So
extra days.
I was a C-section
Wet.
because
Dry?
I wasn't fitting.
Dry, wet and dry, guys.
Wet and dry.
Clean, mama.
But my sister was 3 weeks early, she was 7 pounds, and my brother was right on time, he was 8 pounds. So, my mom just had big babies. You guys, all your
You want me to help you?
genetics
No, I got this.
determine
Okay.
your baby size.
Remember legs on.
So if you really like those
ABD
really
rolled.
tall, beefy guys, like you
Then-
gonna have big baby.
All right.
Actually, ABD I wouldn't probably. I'll probably do the ABD after.
Okay.
Alright, so.
Push back. Push back. You guys know what to do at this point? Yeah. Same, right? What do we do? What's that?
Dressings.
Asking. We got dressings on.
Okay. Ask.
Anesthesia, can I break? Okay.
Let's see if you can break.
All right.
Nah.
That first glove is already off because we put dressing on. Hi, Mama. Everything went really well. Baby just went over to NICU, okay? Dad's with baby.
Alright, then right here I will get the ABD.
When you wake up, we'll take you to go see baby, okay? Everything went really well.
At this point too, I'm cleaning all around. Anything that's around. There's usually a lot of pile up of blood down here, over here, and then this always goes on here with the dressing. They'll roll the ABD on top, and then we'll do a foam tape.
If you want a pressure dressing, that's how you do pressure dressing.
The nurse will come, exam gloves because we're all covered. She has her Metholex on, so we don't need to be sterile.
And then you also make sure to clean the vaginal area as well.
Yeah, she's gonna
Okay.
do the fundus right now.
Yeah. The, you know, just because you took the baby out here doesn't mean the blood's not still coming, okay? So, very bad for sure.
Like how wet, just here.
There you go. Go ahead and do the fundus. Or he's giving him that, and you push down as a nurse. I'll go on the other side.
Yeah, it stops it removing,
Yeah.
bio.
So at this point, we're just showing you the procedure complete to finish. So right now, blood clots are coming out, any leftover.
So she's pushing on the uterus, and he's cleaning, so you want fundal pressure to help
Yeah.
expel the blood
They'll
clots.
usually put their hand in there and
Okay.
take any clots out.
clots, yeah.
And then if we have anything, we'll ask the doctor, hey doc, would you
Wanna
like
add
to add
that?
it?
The blood
Does that look
and
normal?
the- No, no.
Again, this is not on the test side, it's just to show you guys.
And then cleaning, of course, front to back always, right? Front to back,
Yeah.
front to back. And then Perry pad.
And then again, you gotta